It's not the child who needs to be changed. We have to learn how to accommodate. The first starting point is we learn to teach them. Anything in the world we humans do, there is an end result. With that conversation we are trying to build up with an autistic individual, they don't have a conclusion. So they lose hope. Most of the time, if parents are in discord, parents are fighting, they are not agreeing to one particular thing, and parenting is very authoritative, it impacts the child like hell. Nobody is interested in technology. You see, paper and pen can be boring and irritating, but when we do digital literacy, we find that same child is highly productive. At the end of the day, if I am smiling, my child is smiling, and he's making others smile, that's the success I'm looking forward to.
Hello everyone. Welcome back to India Autism Center podcast, your trusted space for powerful insights, impactful conversations, and practical strategies for autism management and care, neurodiversity, and above all, empowerment of parents. I'm your host for this session, Pooja Datta, and today we will be focusing on a very important discussion. What is aggression in autism and how often it is misunderstood? For today's session, we have with us none other than Ms. Nilanjana Rombuthu. She is an RCI registered professional who is also a developmental and behavioral specialist who is working extensively in the field of autism management and care. Welcome to the session, ma'am.
Thank you.
It's been really a pleasure having you here in this session. So, ma'am, we know your extensive work in Kolkata. You are dealing with autism management, and you are also a strong pillar for parents. When we talk about aggression in autism, diverse people, they have diverse perspectives. It is also taken in as behavior problem in a very negative way. So, ma'am, please tell us, what is aggression in autism and how does aggression manifest itself in various developmental phases of autism?
See, aggression is something, it is wrongly misconstrued with autism field. Aggression is in every human being. In fact, entire animal kingdom have an aggression. Why they have? Of course, if their drive is not fulfilled, their needs are unmet, they will be aggressive. I mean, how much tolerance you have towards your hunger? After a time, you will go aggressive, right? So, human development actually improvised everything to fulfill their drive and instinct. This is for true. Now, aggression is highlighted in case of autism because they have inappropriate behaviors to show the aggression. And the most important thing, that they don't have a proper means of communication. And this is where we are lacking, because common belief is doing speech therapy. But speech therapy is not the problem area. It's the language development and reciprocal communication issue which affects autism. When this will be understood, and I think that will be the starting point when we start understanding where things are going wrong and they are becoming aggressive.
Before we move further, please have a look at who we are at India Autism Center.
Imagine a space designed not just to care for individuals with autism, but to empower them. A place where knowledge grows, support flourishes, and possibilities expand. This is India Autism Center. It is built to redefine how we approach autism. Through education, research, and community-driven initiatives, we create an environment where individuals with autism can thrive. Samavesh, our residential campus, is designed for individuals with autism to live, learn, and grow with dignity and independence. It is more than just a place to stay. It is a space to belong. Manan, our training academy, prepares professionals to provide specialized care. Through structured programs, we equip individuals with the skills to support neurodivergent communities with confidence and compassion. Khoj, our research division, is dedicated to advancing our understanding of autism. Through data-driven studies and collaborative research, we work towards shaping the future of neurodiversity.
Coming back to the session, ma'am. Is aggression a part of autism then? Or children, they try to communicate, or it has some different connotation for children. How would you, ma'am, describe this connection between aggression and autism, and how would the parents understand this connection?
Yes. See, aggression is part of every, like I said, every living organism. But for autism, it is more of a communication. Because in our life, especially today, we have become very nuclear. We have become very self-centered. We hardly have time, the quality time the child needs. It's not about quantity, it's about the quality time. And nuclear family exhaust a parent out, especially the mother. So at the end of the day, when she wants to rest, the child is not being given proper attention, he'll hit out, right? Because he has nobody else in his life to communicate. Socialization is not there. Their families are in isolation. So aggression will be more because expectation is from the parent more for a child. And when parents are not able to understand this, so aggression will be there. Correct. And what happens when the child hits out, we give all kind of attention. So child finds a easier way to communicate through hitting. And also another thing which we fail to understand, the core issue of that hitting. Is there any internal issues which is he's trying to communicate? Does he have pain somewhere? Does he have discomfort? We assume, but it cannot be that way. You have to know what is troubling the child. So it is a communication, right? And we don't work on communication. That is not the concept in India, very prevalent. So communication means low tech and high tech. In our institute, when we are working with parents, we hands-on teach them and we teach the professionals also. We find that it's a beautiful communicative tool where a child actually finds how to communicate with us and they kind of relax. See, one thing everybody needs to understand, it's not the child who needs to be changed. We have to learn to how to accommodate. The first starting point is we learn to teach them. That is that strategy. So when you're using those tools to help him out, he understands, okay, my mama papa is using that. So there is no harm in using myself. What happens is we allow the child to use, we don't use. In training parents, I see mothers are more active. They are more participating. Where are the fathers? How many fathers give time to learn such techniques? It is just not for one parent, it is for the family. The whole family does not accommodate to communicate with the child, the system will be failure for the child. The aggression will be there.
So, ma'am, following this, the parents don't understand how to communicate with the child. The child doesn't know how to communicate. So, is it also, ma'am, there is also improper communication between the parents that may impact even their way of communicating with the child, or even shutting down or not understanding the cues that the child is giving?
This is actually the crux of the whole problem. What happens, usually because verbality is the most common tool we use for reciprocal conversation, speech. And we find most of the individuals can utter words. And we think that what we are saying, they actually understand. We presume. And that's where we are going wrong. So it's not like, why we are going wrong? Because when we are uttering those words, till the time child processes, we are actually giving a lot of verbal prompt there. So what was the initial message is lost on him. So we don't use communication tool to give a correct picture of what actually we want to communicate with the child. Secondly, by default of our curriculum, uh, which is not actually for children with spectrum, what happens is that we are asking too many questions. It's very irritating if you ask too many questions, especially if that's not an interest area of a child. If the child is not involved in that subject, how difficult it can be to talk around it. Nobody starts from the interest area of the child. Like a child is fidgeting. I want to be friends with the child. I want to communicate. I will be interested in what he is interested. The starting point of conversation is that. We don't usually do that. We keep on asking question. School में क्या हुआ बोलो, क्या खाया बोलो. Every time it's a question. So after a time, like you said, yes, they clam up, they zone out. They stop answering you at all. And that can be very damaging because many children have lost their voice. They stop speaking at all because that's very frustrating for them. Anything in the world we humans do, there is an end result. With that conversation we are trying to build up with an autistic individual, they don't have a conclusion. So they lose hope. But if the conversation leads to their interest area or a meaningful conversation, then it is more productive. Like I'll give one instance. There is a person, he loves to ask, he has never gone out of Kolkata. He's never gone. But demographically, he spaces out in his mind. You tell about a place, he'll tell you all longitude, latitude. That's the way their brain is. That's very interesting, right? So whenever I build up a conversation, he makes it 2 point to ask me, because he knows I love traveling. So he'll ask me, which area you traveled? The moment I say, he will start giving me all the details about the place. That kind of mapping is there. But any other subject I want to talk to him, he cannot. He will say, any other time I'll talk to you. He says break and he goes away. So that's an autistic individual.
So, ma'am, relating to what you said, even when someone gives us so much information load, doesn't want to understand us, at some point we give up. If we are pestered, we tend to react. That is what it happens at an extreme levels, I feel.
Our reactions are horrible sometimes. That gives them a very off guard of thing, because sometimes we also have issues in emotional regulation. That is where they don't understand that what regulation, our perspective, our mind, they don't get the picture. We don't tell a child, now mama is sad. So sadness is this. I need to lie down on your lap. You give your hand on my head. We don't do that.
It is assumed that they understand.
I don't know what assumptions are, but the thing is, we don't tell them what is the reciprocal behavior you want. It have to have a very clarity of thoughts when you are dealing with an autistic children. Why don't you use a picture and say, I am sad. It may look weird to you, but for that person, that means a lot. Nobody is interested in technology. Technology, you see, paper and pen can be boring and irritating. But when we do digital literacy, we find that that same child is highly productive. In our classes, we are doing it. So it will take ages to understand Indian parenting, because Indian parents, everybody is not tech savvy. So they fear, I am not tech savvy. So can I? I'm requesting everyone. It's not that difficult. Bare minimum of knowledge will help you. If you know how to use a mouse, you know how to type, enough. That bare minimum knowledge everybody has, you can. You type on WhatsApp, right? So why you can't type on a keyboard? How difficult it is? So technology is something they adapt like a fish to a water.
Greatly explained, ma'am. There is often a fine line between, like, in our understanding about hitting others and self-injurious behavior.
Yes.
So, can you please, ma'am, elaborate on this?
Self-injurious behavior and hitting others are very different. A child, see, this is where the demarcation of everybody else is and our children is. They have a lot of self-injurious behavior. Not everyone, but most of them. Some will do head banging, they'll bite themselves, they'll peel their skin, they can tear their hairs. There are so many things they can do. Some are very painful things. Now, we think that it is painful for them, but actually the case is not so. They want the pain to regulate themselves. So, this is very difficult juncture to teach. It can be regulated to a certain extent with alternate sensory diet. But I've seen that in most of the cases, it becomes really difficult. So, alternation has to be planned appropriately, keeping in mind the sensory input he needs to do that. Only then you can do the transition of self injurious behavior. Now, hitting others have two very big reasons. One, which parents will never tell you, they hit the child, or they have quarreling parents. Most of the time, if parents are in discord, parents are fighting, they are not agreeing to one particular thing, and parenting is very authoritative or very indulging. It's not a balanced parenting. And when they are small, somehow parents hit. It's an Indian culture. You cannot go away from this. Today, some reels are coming where it is highlighted that teachers can hit. No, nobody can hit a child. Okay. Nobody means nobody. Nobody on earth can hit a child. Nobody can hit anyone.
Right.
We hit because we cannot hit the father, we cannot hit the maid, we cannot hit the grandparents, so we hit the child. A mother in frustration does it. But it impacts the child like hell. So, somewhere, if the child has self injurious behavior, they readily adapt to hitting others also. If the child doesn't have self injurious behavior, then they develop some kind of hitting which tells us that there is some internal problem like constipation, acidity, sleep disturbance, worm issues. There are many factors we need to study. So, like pinching, the girls start pinching. Quiet girl, nothing of the sort is a problem, and suddenly when they hit puberty, they start pinching, they start scratching. So, it is an indication that internal hormonal changes are there. Some sensory stimulation is going in her body and she doesn't know what to do with it. So, she wants attention to regulate herself. So, they start doing it. So, you have to understand what it is. And I think everybody, starting from the parents and the professional involved in this field, should know behavior assessment functioning. Even the doctors. They cannot be spared in this because the most misleading misguidance comes from here, and therapists also are taking advantage of it. So it's a kind of a nexus. Every day we find a scammer saying certain things of cure. There is no cure.
Autism can be cured. It often comes.
They grow old as an autism individual
It
only.
is a condition we know.
What you can do is you help them regulate, you help them teach self-helps to become independent. Yes, those things can be done. But that doesn't mean they outgrow autism. This is a cure is something, agar somebody is saying, I'm curing, please stay away from that person because that person is a scammer. The science couldn't prove, the medical field is still struggling, then how can one Ayurvedic person puts a tag and DR and says, I can cure? It cannot happen that way.
True.
All these are scammers. They take advantage of illiterate people and educated people also. Educated people are also becoming fool in the hands of this statement, curing autism. There is autism mimicry. You have traits like autism, but it's not autism. So that goes away and they say, see, I have cured autism. It was not there from the beginning. Autism never goes away. But that doesn't mean a child doesn't learn to survive. They do. You have to teach communication. You have to do structured teaching.
To the viewers watching there, if you are watching this video and you feel that you're learning something new, please do not forget to hit the like button. Coming back to the podcast, ma'am. Now, if we focus on solution and strategies, So during an aggressive outburst, what do you feel based on your experience? What parents they should do, and what are some of the pointers that they must avoid?
See, this is where parenting learning strategies is very important for every parent. They should know how to handle behaviors and all. Before we get into the management thing, parents want an answer, they want an guidance. So, if they go to a doctor will prescribe medicine for whatever reason. I'm not going to get into that. So, what does a parent learn? That medicine is the way, it's going to solve the problem. But nobody tells, those doctors don't tell. Nowadays, doctors are also changing versions, but it will take a lot of time period more. So these doctors, they tell that yes, medicine is there. If they don't, then they'll go somewhere else. What kind of logic is that? I don't know. Now therapists also have started telling parents, go feed medicine and then come over here. Lot of parents have told me that therapists are doing so. Even speech therapists are doing so. I'm directly telling this on our podcast. What goes wrong? Understanding of a parent. If all of them in united way tell the parent that the structured teaching and communication and behavior modification is everything, non-intrusive methods are everything, don't you think a huge problem solves? It's all about understanding autism, understanding their brain processing, how they look at the world, how they process everything. I think that solves a problem. And this knowledge, when you give it to a parent, they actually start understanding in a different light. This is what we require. As much you people have followed me, the kind of programs I do in parent empowerment program. I don't much deal with professionals, I deal more with the parents, because I know when a parent will understand handling, 90% of their problem will go away. Now, yesterday only one of the parents said that, ma'am, okay, I understand that I have to teach that, I'm getting result, all is everything and good, but he cannot survive alone. But that's the diagnosis. That is the worry we have to do. It is our duty to do so. What after is a concern, a child is not supposed to do so. It is us we need to. And this botheration makes a parent compulsive to get into wrong things, because survival is something they all are looking forward to. Where we don't have a proper kind of a setup, we don't have a proper kind of a caregiving unit, we find stress, anxiety, that how my child is going to survive after us. But that is a different story. When it comes to an autistic individual, it's about coping with the life skills so that he is at least independent. If child is not toilet trained, he cannot have independent eating, he cannot move an inch without hand holding, that is a fault of parenting. That is where we need to work out. Because if we don't do that, it will be very challenging for a caregiver to do so. It's not humanly possible. Their mental health also matters. Somebody dealing with your child needs a lot of mental health capacities. Right?
So, ma'am, you are asserting, you are being confident that medication is not needed in autism.
No. Medication is needed. You have to understand if the medical things are there. The child is having a seizure, child is having infections, child is having epilepsy, then you need there's a evidence for that. There is no evidence where you are giving medicines. In fact, in London now there's a act where before age of 14 you cannot give medicine.
So not even for managing the associated conditions, the comorbid conditions of underlying depression,
it can be
anxiety.
taken care with structure teaching.
Okay.
As much you structure, they are as much independent. So if I can have an alternative which is far more productive, why should I go into medicine? Because giving medicine means you are suppressing the problem. The core thing is not resolved. So it bounces back. How much medicine you are going to give?
So, ma'am, what about we hear about both medication as well as therapy? They run parallel and it is more effective when we are managing individuals. So, ma'am, what's your take on it?
See, the problem in India is there is no proper kind of diagnostics tool. Okay. Now, the diagnosis, what they need is more on a functional level, because we all say that they have different kind of, they are anywhere on the spectrum. So, no child is same. So, what makes them different? Have you ever realized? Most of the questionnaires to assess a diagnosis is by taking information from the parents. It can be biased. No parents are going to honestly tell you a lot of things. So, majorly, lot of issues are not addressed. So, we are unconclusive over there. Functional assessment should be regulated in India, which is not happening because government still has not understood the importance of behavior modification. So, I think a lot of voice is necessary over here to make a move in this matter, to make it more legalized and more adaptive. I hope things happen. And the day it will happen, we have a better screening tool, we have a better understanding tool, and we have a better diagnostic tool. A lot of lives will be saved. Because if a child, see how the parameter works. Child is supposed to be over here and they are deviated. You work on deviation, you come over here. But the problem is so much pushing, so much hand-holding, so much verbal prompt is given that they lose by the age they come in as teens. They zone out, they are mentally, havoked. So it's really bad thing. But as much you work on communication and structure, they're very good human being. They adapt.
So, ma'am, living with autism, it is overwhelming and exhausting. So, parents even they find themselves to be overwhelmed in lot of stress and anxiety.
Why?
That is it, ma'am. Why? And if you can address some of the management strategies, some of the tools, if it is available, to address this parental burnout and exhaustion.
Parental burnout because they lack acceptance. It's not problem of a child. It's a problem of parents, their expectations from the child. So the why question is, parents don't want to accept that their child is having autism. And that's why they want some miracle or some kind of magic wand and come and tell you that things are going to be okay. So they spend money for that. They don't spend money to learn the thing. Okay. As you know, I do a lot of empowerment program. And I'm so happy that I do. Because those parents who are working with their children, both parents, not one, both parents, believe me, the child is having a best of the life. So it's not the problem with the child, it's a problem of parenting. Parents are not ready to accommodate their lifestyle. Lifestyle changes are necessary. More structure, more routine is necessary. Parents don't socialize. Either they leave their child home, hardly they take them out. Very few parents take them out. But socialization doesn't mean going to hills, seaside. Socialization is mixing with others. They want neurotypical families to mix. They will not. What harm is there to mix with another profound child and their family? Where is the harm? They are somebody's child. I face this question quite often, where parents come and say, "Ma'am, I don't want my child among these." Why? They are not human. They are not anybody's children. I tell them where the door is. Because if you cannot accept other child in your child's life, then you don't deserve to be here. The problem is with the parent and their understanding, not with a child with an autism.
So, ma'am, again from your experience, can you please share with us some success stories where when we understood the why of communication, the meaning changed and the life of the child and the family changed?
Yeah. See, what do we understand from communication is not that what I'm asking the child and the child will do performance. communication is when the child will come and tell you their feelings, what they feel, what they like, and when you are reciprocating that this is what I accept and that is what I don't accept, and they are quite okay. That's what we want to do. So that is the success story. See, success is what? Getting a reward, an award. They don't value award. They're one of the most simple human being on earth. For them, success is your smile. At the end of the day, if I am smiling, my child is smiling, and he's making others smile, that's the success I'm looking forward to. They're happy with positive engagement, they are good, doing good things. That's my success. Sunshine is a success story. For last 20 years I'm working and I have children and their families smiling. They have reduced stress, they are communicating, they are doing good jobs, parents have gone back to jobs, so much development. That's the success story. Today my boy has become an adult, so I have opened an adult unit. They are running this jamming cafe. That's a success story. They're serving tea, coffee and sandwiches. They're making it by themselves. That's a success story. In that, there is a boy who cannot cut and peel. He cannot do so. My boy and another boy, he can. But this boy cannot. But he can serve. That is a success story. It's okay if he can't cut. But he can serve. That is a success story. Today, I feel sad and I say, Rahul, I need a hug. I'm feeling sad. He'll come and give me a hug and he'll do like this. Don't phone. That is a success story. So what else you need? If somebody comes and tries to be good with your child and he reciprocates, that's a success story. For me, becoming a lawyer and a historian or anything else doesn't mean success. Sustaining life at your own will is a success.
True. So before leaving, ma'am, one final message to the parents who are really finding it hard to manage the aggression of their children as well as self. What will you say to them?
First, sit down and think what you are doing wrong, not what the child is doing wrong. Because in most of the cases, it stems from us to them. It's not from them to us. You'll find answer there. If you're quarreling, if you are in disagreement, if you are fighting in front of the child, you're dictating terms in front of the child will have a disturbed life. And that's for any childhood. Normal childhood, if we say, they too have issues. Everybody has an issue. So how it can be different? It cannot be different. So parenting is something very important. We have to focus as early intervention and intervention. Intervention and is not like giving therapies. It's about how parents start dealing first with the child. Toilet training, daily living skills are equally important for as academics are. You are pursuing academics and you don't toilet train your child, what will be the end result? You cannot do it at the age of 16 or 17, which is to be done at the age of 2 and 3. This perception that he'll go to school and learn is a very wrong perception. It starts from your home. Everything starts from your home. Look at your own family structure. Isko theek karo. And then you approach your child.
Thank you, Nilanjana ma'am, for your valuable inputs in this session.
Absolutely. Thank you.
To our listeners, if you feel that this video, it is impactful, you have learned something new, you are a little bit empowered to manage aggression in autism, please do not forget to subscribe our channel and hit the like button. Until we come on with the next video, please have a look at the video that is popping in your screen. Thank you so much.